Hello everyone, Dr. Daniel Payton here, paediatrician. Right now I'm going to talk to you about diagnosing ADHD, how you might go about it, what's involved in that process, and why you might want to do it. Okay, so first of all, when we diagnose ADHD, it's important that we undertake a comprehensive evaluation. So what does that mean? Well, it means a few things. It means we want to gather a lot of information. And we often want to gather a lot of information from not just the child or the parent, but from other sources, such as the teacher or other people who might be involved in the child's life to see what level of symptoms that child might have. And then we want to go through a process of understanding what the frequency of the symptoms are, how many symptoms of ADHD they might have, how long those symptoms have been going for, and probably most importantly, what sort of impact those inattention or hyperactivity symptoms might be having on their everyday life. Because in order to reach diagnostic criteria, it needs to impact them in a couple of areas of their life, academically or socially, or at home with their behaviour and relationships in the family setting. We also want to exclude other problems. We want to make sure that the symptoms that they're having around inattention or hyperactivity aren't from something else. Might be a hearing problem, a vision problem. Sometimes, rarely though, there can be a medical problem such as thyroid or anemia. There can also be a lot of other problems, mental health problems, that can also look a lot like ADHD or can make just a small amount of ADHD or inattention or hyperactivity symptoms seem much bigger than what they really are. For example, if a child has anxiety and that anxiety is impacting them on a regular day, that anxiety can distract them in the classroom. And until we treat their anxiety, we won't really be able to see how much of the problem is from ADHD. And this is really important because ADHD and anxiety treatments are very different. And really important is ADHD medicine can make anxiety worse. So it's super important that we really understand exactly what's going on. Not just what's happening with the attention, what's happening with the hyperactivity, but what is everything else that's happening in that child's life that can impact them. And the people, the professionals that can go through and do these diagnoses or assessments are usually paediatricians, psychiatrists, and psychologists. Importantly though, the paediatrician is generally the one who's easiest to access and can treat ADHD with medications. Hope that's been helpful.